Hey, good afternoon. I'm Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and today we're going to talk about brachycephalic breeds. Brachycephalic breeds are breeds of dogs that have a very smashed face appearance. Their nose is very, very short and their face is almost flat relative to the actual nose. Breeds that would be classified as brachycephalic would be dogs such as English Bulldogs, Boston Terriers, Shih Tzus, Lhasa Apsos, French Bulldogs. Those would be probably the most common types of brachycephalic dogs that we see in practice. The most common health problems that we see in brachycephalic dogs would include something called brachycephalic airway syndrome, where the dogs, because the dog's nose is so short, it has impacts not only to the nasal cavity, but also to the oral cavity as well. And they end up having oftentimes a very elongated, soft palate, and that makes it very difficult for that dog to breathe. Other problems we'll see with brachycephalic breeds, but can also be seen with other small and toy breed dogs, would be collapsing trachea. I think that those are probably the two most common problems that we see. Breathing difficulties in short-nosed or brachycephalic breeds generally is displayed as panting or open mouth breathing that is not necessarily associated with exercise or activity. And also, even more common than that oftentimes is a very loud respiratory noise. It sounds like the dog is working hard to breathe. Sometimes they sound like little pigs, they're kind of snorting. And that's because their airway is so collapsed that they're having trouble actually moving air through their nasal passage and breathing properly. From an owner standpoint, some of the things that an owner can do at home to help manage their dog's brachycephalic airway syndrome would be to not exercise that dog during very hot and humid months of the year and or times of the day. So here in the South, we have hot and humid days for many months out of the years. So we would encourage our owners who are going to exercise their dogs to do so very early in the morning or late in the evening, where it's the cooler times of day and the humidity may be just a little bit less. Other things that can be done would be to manage their pet's weight. Obesity absolutely magnifies the problem of a smushed-faced dog's breathing problems. So maintaining that dog at an appropriate body weight would be a big help. With regards to what a veterinarian can do and speak into that situation, oftentimes these dogs, their breathing problems are so severe that surgery is actually needed to be able to correct the problem and allow these animals to breathe well. Anesthesia can be safe for brachycephalic dog breeds. We do usually take some extra precautionary measures when we're dealing with these types of breeds under anesthesia. Oftentimes doing what we call pre-oxygenation and giving them oxygen even before we actually induce them for anesthesia. Once these animals are under anesthesia, they actually breathe better than they've ever breathed on their own, because when we insert the breathing tube into the airway to allow the direct exchange of oxygen and gas anesthesia into that patient, we have actually opened up that patient's airway and allowed them to breathe in what should be a normal fashion for them. But because their airways are already collapsed on themselves because of their conformational defect of being a brachycephalic breed, we're actually giving them better oxygenation under anesthesia with an endotracheal tube in place than that dog is actually able to achieve on their own when they're not under anesthesia. There is a surgery specific for these breeds where changes are made to the oral cavity and to the nasal openings to allow these dogs to breathe easier. If their pet is in need of the surgery, then surgery is the #1 way you're going to help these animals be able to breathe better and have a healthier life. Outside of that, again, not every brachycephalic dog will need the surgery to correct their conformational defects. But again, I would encourage people to, if you have a dog who's brachycephalic, talk to your veterinarian the next time you're in. Give us a call. We're happy to answer any questions you have about whether or not your pet is having significant breathing problems and whether or not your pet would be a good candidate for that surgery to correct that problem. So thanks for spending some time with me today. I hope that you found this discussion to be helpful. If you have any questions, please don't hesitate to reach out to us at Tuscan Ridge Animal Hospital.